Thank you for joining us on Health Matters. I'm Dr. Mark Castellaw. Our program this month has been about screening for different types of cancers. We've talked about colon cancers and colonoscopy, and we're talking about mammography and breast cancer. My two guests next are patients that have undergone both testing, and we're going to discuss that. Carol Light is our first guest. How are you doing, Miss Light?
I'm fine, thank you.
And Miss Wellbrock is our guest. Now, before we get into the mammography questions, I wanted to emphasize a point with Carol. Carol's had a colonoscopy, but Carol, tell us why you got that.
Well, I was prompted to get that because one of my dear friends did pass away from colon cancer, and I always felt that if she had got the screening earlier, that would not have happened. So that prompted me to go ahead and have it, and I'm really glad I did.
Well, unfortunately, Carol's colonoscopy was normal, but again, you just don't want to wait too late. Please follow your doctor's recommendations about screening procedures. Now, Carol, tell us about your experiences with mammography.
Well, I've always been proactive when it comes to my health, and so I've been faithful in scheduling those screenings as I've been directed by my physician, and I'm one of the fortunate ones there also that nothing has ever shown up, but I will continue to do that. I think we women should just get it on the calendar and do it. And
stay current with that every year, whatever the recommendation is that they give you. Well, great. Well, Ms. Wellbrock, you had a little different experience with mammography and having some breast problems. Tell us about what your experience.
Well, initially I found the lump myself, which is very important for all women to do a self-check. And I found mine actually when I was taking a shower. But the physician that I saw, the surgeon that I went to see, he checked it, and he, at that time, and so I had a mammogram done. The lump did not show up on the mammogram, but it was still there, and he just felt like there was something more to it, and so did I. And so he did a biopsy, and the biopsy showed that it was malignant, and then scheduled me for surgery.
And since then you've had surgery and currently cancer-free?
I am cancer-free, 26 years in January.
Wonderful, what a blessing. Well, Ms. Wellbrock points out another very important method of screening for breast cancer. Doing self-examination monthly for women is very important because, as she stated, it was inconclusive with the mammogram, but because that she had a lump, the surgeon proceeded with the procedure and found that there was a malignancy. So not only is it important to have your annual mammogram, but it's also important for you to get an examination either by your doctor or even doing self-examination. So, Ms. Wellbrock, what would you tell our viewers to do as far as self-examination and mammograms?
If you have a lump, then continue to insist on something. If you feel uncomfortable that the lump is there, that the mammogram, even if it did not show it up, be progressive in your action. Make sure you see the physician. Don't wait. Because of my going right away, I was very successful. The malignancy was taken care of, and I've been very well since.
Well, as Ms. Wellbrock pointed out, on most mammography reports, it does say that with mammograms, if you have a palpable mass or a lump that you can feel, kind of regardless about what the mammogram shows, you need to see your doctor, get it checked, and make sure it's not anything of significance. So thank you all for being with us, and again, we need to encourage women to get their annual mammogram.